here, a board-certified specialist internist. Thank you so much for joining me, even as we explore hepatocellular liver injury today. I strongly encourage you to subscribe to my channel if you haven't yet done so. So hepatocellular liver injury, by and large, refers to the predominance of aminotransferase elevation, also known as transaminases. That's your ALT and your AST, your adenine aminotransferase and your aspartate aminotransferase. So these are elevated compared with the alkaline phosphatase or the ALK-phos. Serum bilirubin levels may or may not be elevated. Aminotransferase elevation is mild when it is below 5 times the upper limit for normal, moderate when it is 5 to 10 times the upper limit of normal, and marked when it is greater than 10 times the upper limit of normal. The causes of hepatocellular liver injury, by and large, can be certified into the following categories. Right, so we have infectious, toxic, vascular, hereditary, and others. In patients with hepatocellular liver injury, the degree of aminotransferase elevation and the ratio between the AST and the ALT can help narrow the differential diagnosis. Marked aminotransferase elevation is usually the result of acute liver injury, which can be caused by acute viral infection, usually hepatitis, and specific kinds of hepatitis, mainly hepatitis B. Drug toxicity, especially paracetamol poisoning, ischemic hepatitis, so-called shock liver, autoimmune hepatitis, mushroom toxicity, that's the Amanita phalloides, or Wilson's disease. Right? So let's look at infectious causes, guys. The hepatitis family A through E all can cause hepatocellular liver injury, as can Epstein-Barr, cytomegalovirus, herpes simplex virus, and varicella zoster. Toxic causes include alcohol, right? So people who drink a lot, those who have binges, and those who have chronic liver disease with acute decompensation. Medications can cause it, so can recreational drugs, iron in the way of hemochromatosis and Amanita phalloides mushrooms, vascular issues like ischemic liver, so-called shock liver in patients who are hypotensive, liver congestion, especially on the back of right-sided heart failure, Budd Chiari, which we know is hepatic venous thrombus, hereditary issues, hemochromatosis, which is iron overload, Wilson's disease, which is copper overload, alpha-1 antitrypsin deficiency, which keeps company with low predominant emphysema. Other issues is NAFLD, quite common in our era of metabolic syndrome and diabetes, non-alcoholic fatty liver disease, right? Autoimmune hepatitis, don't forget. And the markers you want to look for there is the A and F, which is usually positive, together with the anti-liver kidney microsomal antibody. Acute biliary obstruction can cause it. HELP syndrome, which is hemolysis, elevated liver enzymes, low platelets in the setting of pregnancy, and of course celiac disease. And there's a gluten-sensitive enteropathy. And the antibodies that help you is the anti-gliadin, anti-endomycin, and anti-transglutaminase antibodies. This is a handy mnemonic from medicawesome.com for hepatosplenomegaly. Right, so this is a small aside, right, but it's nice to know. So H stands for hematological issues in the way of myeloproliferative diseases, thalassemia. E is for Epstein-Barr, and also Epstein-Barr's cousins like cytomegalovirus and rubella. P is for portal hypertension from whatever etiology. A is amyloidosis. TO is toxoplasmosis. S is sarcoidosis. P is for pernicious anemia, alpha leishmaniasis. And the cousins of leishmaniasis is tropical malaria syndrome, filariasis. N is for Niemann-Pick, which is a glycogen storage disease, and the cousins of Niemann-Pick is Hunter's, Hurlers, and Gaucher's. Omegaly stands for acromegaly. Quite a handy mnemonic, hepatosplenomegaly. Thank you, medicawesome.com. Okay, my friends, let us look at the purpose of Bible study. So the Bible is described in Scripture as a sword. It's the sword of the Spirit. It's also described as a seed for the bountiful harvest. It's also described as light. It is in the Psalms. David says, "Your word, O Lord, is a lamp unto my feet and a light unto my path." It is the blueprint for living, right? So it's important for us to be studious and to be diligent in study of the word. So S is we should develop a student culture. T, trust the word, because the word works. It illuminates the way forward for us. U, understand the truth, right? Grasp of Scripture helps us to understand God's will for us. D, it helps us, we should have the studious mindset when we study to divide accurately, to be workmen and workwomen approved, right, who are mature and complete, attaining the stature and measure of Christ. Enjoy the word. I think it's Jeremiah that says, "Lord, I have eaten your word," and that Your word in my heart is like a fire, a passion burning inside my bones. I cannot keep it in. I must share it. A study of the word helps us to nurture practice and implementation and trains us for the work of ministry. I hope you enjoyed this video, everybody. I'll see you soon with another rapid review topic in internal medicine. God bless you and take care.